Good evening, everyone. So my next topic of the video, which I'm going to discuss with you, is on the causality assessment of adverse drug reaction in pharmacovigilance. Now I'm going to discuss with you what is the causality assessment of the adverse drug reaction in pharmacovigilance. And before I start my video, I want to request you, if this video is useful to you and if it is helpful to you, kindly subscribe to my YouTube channel, that is Dr. Nitika Pharmacology Discussion. And now I'm going to discuss with you causality assessment of adverse drug reaction in pharmacovigilance. Now, first of all, I will discuss with you what is the pharmacovigilance. It is the science or it is the program. It was started and it is that we assess, we detect, we understand and to prevent the adverse aggression caused by any drug in the used in the therapeutic use of the animals as well as human beings. Means the adverse aggression caused by the use of the drug in the humans and animals. We understand that drug, we detect that drug, we adverse aggression, and we monitor that adverse aggression, prevent that adverse aggression. This field is known as the pharmacovigilance. And in this pharmacovigilance, we study the causality assessment. It is the method by which the extent of relationship between a drug and suspected direction is established. Means it is the relationship between the drug and the suspected adverse aggression. There are various causality assessment scales, and today I will discuss with you two scales, that is WHO scale and Naranjo's scale. Now, WHO scale of assessment, it has the following classification: certain, probable, likely, possible, unlikely, conditional, unclassified, unaccessible, or unclassifiable. Now, these are the 6 categories which I'm going to discuss with you one by one. First of all, certain. Now, there are certain parameters by which we can say that the causality assessment is certain. First of all, there should be temporal relationship. That is the time period of intake of the drug and appearance of adverse aggression should be within 1 week or within 2 to 3 days. Means it is that the patient has taken the drug and adverse aggression has appeared after the intake of the drug. Within 2 to 3 days or more, or within 7 days, the temporal relationship should be present. That is, it should be positive. D challenge is when the patient has taken the drug and the adverse action has appeared, and now the patient has come to the prescriber and said that I am suffering from this and particular adverse action, like I'm suffering, ampicillin is there and I'm suffering from diarrhea. So the prescriber, he will stop that drug, ampicillin is stopped, and we see that diarrhea disappears. Miss D challenge is there, that after stopping the drug, the adverse reaction disappears. Miss D challenge is positive. So that is also comes in the certain category. And the re-challenge is also positive. Re-challenge, how it is positive? Means it is that when we again after stopping the drug, after a certain period of time, we again reintroduce the drug, like we reintroduce the ampicillin again, and then we see that on increasing the dose of the ampicillin, the adverse reaction again appears. Means it is that re-challenge is yes, means it is positive. So again, it comes in the certain category. And then the causal relationship, that is the pharmacological and pathological actions of the drug should explain the adverse drug action. Means the pharmacological action of the drug explains the occurrence of the adverse drug action. If it is positive, then also it comes in the certain category. And then the last thing is, it should not be related to any other drugs. Means it should not be that the adverse drug reaction has occurred because of any other concomitant therapy. Concomitant therapy is that therapy which is taken, the patient is suffering from some disease and the patient is taking 2 to 3 drugs, and one drug is the causative agent of the adverse aggression. But if the other drugs also explain the occurrence of the adverse aggression, or the underlying disease condition explains the adverse aggression, then it doesn't come in the certain category. It should be no. Means the other drugs and the disease condition should not explain the adverse aggression. Means this is the certain category. And now how we explain is event or laboratory tested novelty with possible time relationship to drug intake. With the drug, it was agreement, it should have the temporal relationship. Cannot be explained by disease and other drugs. This I've already told you, should not be explained by disease and other drugs. It should have response to withdrawal possible. That is, the D challenge should be the response to withdrawal. It should be positive. D challenge should be positive. Event definitive pharmacologically and phenomenologically, an objective and specific medical disorder or recognized pharmacological phenomena. Means it should explain the causal relationship should be present. The pharmacological action should explain the occurrence of the adverse drug reaction. Re-challenge satisfactory if necessary. Re-challenge should also be positive. So this comes in the certain category. Probable is everything is similar. Means temporal relationship should be present. D challenge should be positive. Means the patient has stopped the drug and the adverse reaction has disappeared. And re challenge should be negative. Re challenge should be negative. Means again we reintroduce the drug and the adverse reaction does not again reappears. Means the re challenge should be negative. And causal relation should be present and it should not be related to any other drug and other disease condition. If this is the condition in which the re-challenge should be negative and all the things are same like certain, it comes in the category of probable or likely. This event or laboratory test abnormality with reasonable time relationship to drug intake, unlikely to be attributed to disease or other drugs. Response to withdrawal, clinically reasonable, and re-challenge is not required, means re-challenge is a negative. And D-challenge is positive. This is probable or likely. Now, possible is D-challenge is also negative and D-challenge is also negative. Time relationship is present, temporal relationship is present, and it can also be explained by any other drug or disease condition. And causal relationship may be related. Means the pharmacological action may or may not explain the occurrence of the adverse drug reactions. And D challenge is negative, re challenge is negative. It can be explained by any other drug or underlying disease condition. Temporal relationship is positive. This is possible. Means event or laboratory test abnormality with reasonable time relationship to drug intake is there. And it could be explained. It can be explained by disease or other drugs. And information on drug withdrawal may be lacking or unclear. Means the D challenge is negative and D challenge is also negative. And causal relationship may be related. Causal relationship may be related. Unlikely is D challenge is negative, re challenge is negative, and the temporal relationship is also negative. And the only thing is it could be related to the disease or drug in other drugs. And causal relationship, pharmacological relationship, it is also negative. It may not be related to the causal relationship should be negative. Means the pharmacological action of the drug doesn't explain the occurrence of the adverse drug reaction. Means event or a laboratory test abnormality with a time to drug intake that makes the relationship improbable. Means it is temporal relationship is negative, D challenge is negative, D challenge is negative. It has the diseases and other drugs provide the plausible explanation, and causal relationship is also not related. This is unlikely. Conditional is event or laboratory test abnormality. More data for proper assessment needed. Means the data for the previous data for the detection of adverse drug reaction according to a particular due to a particular drug, the more data has to be needed. Additional data has to be needed. Other reports, various adverse drug reaction reports are less available, and the more data has to be needed to say that the causality assessment is conditional or unclassified. Unaccessible or unclassifiable is report suggesting an adverse drug reaction cannot be judged because information is insufficient or contradictory. Means the information which is available, it is not sufficient or it is a contradictory or data cannot be supplemented or verified. The data available, it is not supplemented and it is not verified. So this is the six categories of the causality assessment of WHO. This is unaccessible or unclassifiable. Now, Naranjo's ADR probability scale is that there are certain questions, like 10 points are there, and according to yes and no, the numbers are given like +1 for yes, 0 for no, and +1 for yes, -1 for no. Accordingly, the numbers have been given, and the scores are like this. If the score is 9, the ATR probability classification is highly probable. If 5 to 8, it is probable. If 1 to 4, it is possible. If 0, it is doubtful. The score is this, and the probability classification is this. The various points are there any previous conclusive reports on this section? Is previous knowledge. If it is available, then it will be +1. If not, then it will be 0. Did the adverse event appear after the suspected drug was administered? Means temporal relationship is present or not? Accordingly, we will see yes or no. Did the adverse action improve when the drug was discontinued or a specific antagonist was administered? Means D challenge. When we gave the D challenge, whether it was yes or no. Did the adverse reaction appear when the drug was re-administered? Means re-challenge was there, and whether it improved or it appeared, the adverse reaction appeared or not? Yes or no, like this. Are there alternative causes other than the drug that could on their own have caused the reaction? Means other drugs are responsible for the adverse reaction or not? If yes, then it is negative, and if no, it is +2. Did the reaction reappear when the placebo was given again? If it reappeared, then it is -1. If it does not reappear, then it is +1. Was the drug detected in the blood in concentration known to be toxic? If yes, it is. If it was toxic, then if it is +1. If it was not, then it is 0. Was the reaction more severe when the dose was increased or less severe when the dose was decreased? Means this thing to check the status of the adverse reaction, we can say yes or no. Did the patient have a similar reaction to the same or similar drugs in the previous exposure? If yes, then according to previous data available, we can say yes or no. Was it was even confirmed by any objective evidence? If yes, then it was yes +1, no, it was 0. So in this way, the total score is calculated and then ATR probability classification is done, like highly probable, probable, possible, doubtful. Thank you. That's all for causality assessment of WHO and Naranjo's scale. I hope you understood my video. If you understood my video, kindly subscribe to my YouTube channel. That's Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed, be safe. Happy learning. Thank you.